Hello, everybody. Welcome to the Very Connected podcast. We're so happy to have you guys here today. Thank you for joining us. And we are joined by a very, very, very special guest. Her name is Sarah Polk. She's a registered dietitian local to me. We live in Missouri. Sarah lives a little north of where I live in the more of the St. Louis area. Yeah.
Yeah. I'm in South City here in St. Louis, and yeah, I'm glad we've been able to meet in person a few times back when I was working for the hospital a few years ago.
Yeah, we definitely have. Sarah's more independent now, so she does see patients. Her major niche market is still bariatrics, and she does work independently, but she also works with providers up in the St. Louis area. And I want to say, let us know, you guys, where you're from. Oh, I see Enid. Thank you, Enid, for saying hi. I miss you. She's in here from Tampa, Florida. Let us know, you guys, if you're on the live event, let us know where you're joining from, what city, state, if you want to tell a little bit about yourself. If you're on a weight loss journey, if you're either pre-op, bariatric surgery, post-op, if you're on a GLP-1, any of those things, let us know a little bit about you. We'd love to know. And we're going to start out, I'm going to do a little introduction of Sarah and like our topic for today. I'm really excited about this because I feel like this is a topic that we have never talked about. And Sarah kind of brought this to me and was actually just sharing a little bit about what this looks like and what it is. So I'm excited to have this. I'm pulling up my notes here because this is such a new topic to me and it's taken it just a second. Okay. So we're going to talk about nutrigenomics. I hope I'm saying that right, Sarah.
I say Nutrigenomics, but I think it can be pronounced
Okay.
either way. Yeah.
Thank you for correcting me. And how genetics can help explain why patients respond differently to nutrition and weight loss strategies. We're going to break down testing, how it's used. Sarah actually is going to be sharing one of the reports that actually shows what things are measured and kind of what a normal report would look like. We're also going to help overcome some common misconceptions and talk about how you can understand how your body can make more informed choices about health. And a little bit about Sarah. Like I mentioned, she is a registered dietitian, and she's certified, and her specialty is in weight management. She has a master's degree in nutrition and dietetics, has worked with both surgical and non-surgical settings. So she's passionate about helping people who are maybe have some years of conflicting nutrition advice, maybe and inconsistent results in the past. And I love your approach, Sarah, because it's not just a one size fits all strategy to weight management. I know that you like to work specifically with patients and find out kind of what their specific issues are and help break that down because everybody's a little different. So, in that, welcome. And I'm going to allow you to tell a little bit about yourself and more about the topic. And also
Perfect.
more about what brought you into this industry.
Yeah. I'm gonna go ahead and share my screen too. It's always, I think, nice to have a visual. But yeah, thanks for having me, Brenda. I'm really excited to be here. Like Brenda said, I'm a registered dietitian. I saw someone on the chat is from Kansas City, so I got my master's degree in Kansas City back in 2022 is when I graduated from that. And I knew after getting my master's that I wanted to specialize in something with nutrition. There's so many things everyone eats. Everyone's got an opinion about food, and I really wanted to be a specialist in one specific thing. I'm from the St. Louis area, so I knew after graduation that I wanted to move back home closer to family. And a job came up specializing in weight management at a bariatric clinic. So that's how I got that opportunity. And I've loved it ever since. I think what I love so much about the bariatric community and the weight management community is that everyone's so motivated. People want to talk to me. So, and I love seeing the results and the transformations. I think it's the most rewarding. So, Yeah, and sorry if you hear my cats in the background there. Um, excited to be here as well. So hopefully everyone can see my screen. Can you see that okay, Brenda? Yeah, okay.
Yes, we can see your screen perfect, and we do not hear your kitty's cats. I think it's
Oh,
filtering it out. So,
well, you might see them, so. So within my clinic, so I started my own private practice beginning of 2025. So I've had it about a year and a half now in the St. Louis area. And one of the things that I offer is nutrigenomic testing. So looking more at how our genes influence our nutrition. So not everyone is the same, and it's always good to know more about ourselves. So this is another way to kind of personalize that nutrition. So when looking at nutrigenomics, so exactly what is that? It's the study of how our genes influence the way our bodies respond to nutrients, different foods, dietary patterns. So with that, you might have noticed in the past, why can this person lose weight faster than me? Or why do I not tolerate gluten or lactose well, but other people do? Why am I deficient in a vitamin even though I'm taking that supplement? These are common questions that genetics can kind of help answer. Everyone's different, so there's not one size fits all approach when it comes to nutrition. So this is another way for us to kind of figure that out. I always say that genetics trumps everything else. There's so many factors that go into weight management, and genetics is always is the biggest one. Research shows that more of a DNA-based dietary advice increases your motivation too. I think motivation's a big thing when it comes to weight management, and enhances long-term uh, like compliance or being able to like keep that weight off and kind of preventing, I think, that yo-yo dieting, which a lot of us who have struggled with weight are used to a lot of back and forths. So really being able to lose that weight and keep it off in the long term. So the same diet paradox, I kind of touched on that. It's that the idea that we all could be on the same diet, but everyone's going to react differently. And there's so many factors that go into that. Genetics is just one of them, and that's what the nutrigenomics test looks at. But it also could be dependent on maybe like the type of procedure that you had if you're a bariatric patient. It could be dependent on our gut microbiome. There's a lot of research coming out with that. Different medications can impact how we respond to weight and food, sleep quality, stress, exercise. Genetics really is just one piece, of that puzzle. And that's something that we'll be talking about more today. Specifically for bariatric surgery, I wanted to touch on that. There's some challenges that can come after surgery. I always say surgery is a tool. So really looking at that post-op care is really important. So having a really good team to help you, because you might experience like weight loss stalls. You might notice some food intolerances or sensitivities develop after surgery, unexplained vitamin and mineral deficiencies, maybe some low energy or fatigue, difficulties with that long-term weight maintenance. And so nutrigenomics can help kind of answer some of those problems. And how it differs from a traditional approach. Traditionally, just general guidelines for like protein and carbs, what kind of a range, a blanket statement, and kind of similar advice for most people. But the nutrigenomics test, you really are eating according to your genetic makeup. So more individual insights you'll get and more tailored recommendations based on your genes. So what the test is, it's a really quick test. It's a mouth swab. It takes like 15 seconds. You get a kit mailed to your home. You take the test and it comes with an envelope that's already stamped and addressed. So you just put the swab back in the tube and you mail that off to the lab. It takes a couple weeks for the lab to process those results, and then we receive those results, and we'll go through those together and see how we can apply your results to your nutrition. Usually I always create like a meal plan based on your results as well so that you can really apply that to your everyday, and we'll go through your results together. They test over 70 different genes, so there's a lot to go through, and it's a lot of information. So follow-ups, I think, are really important with that as well. So it can look at, so like I said, it tests over 70 different genes. So we can look at how you metabolize different micronutrients like folate, B12, how you metabolize caffeine, that's a big one. Some people are slow metabolizers when it comes to caffeine versus fast. That's a big thing. We look at macronutrients, so you can get more personalized protein goals, carbohydrates, fat metabolism. A good example with that would be like the keto diet. That was a really big trend there, I would say like 2020. And based on your genes, not everyone's going to respond well to the keto diet because you might not really metabolize fat as productively as someone else. So that's something to look at. Appetite control. So looking at like hunger cues, appetite. With these tests, they're not diagnostics. So I'm not saying that you have like type 2 diabetes, for example, or you have heart disease. But these kind of things will help prevent that. I think it's really important to be proactive with our health instead of reactive. So kind of knowing these things, knowing if we're with the appetite control, that gene looks at our predisposition for obesity. So knowing those things can help us prevent future comorbidities, which is really, really neat, I think. Some examples too with the results. So one of the things we look at is vitamin D deficiency. You could be taking the recommended daily allowance for vitamin D, but still be deficient. 3 out of 4 people actually have the gene for vitamin D deficiency. They're just more prone to it. So you might need to be taking a little bit more vitamin D than the recommended daily allowance. That is the general blanket statement for most people. That's just one example, and we look at a lot of different vitamins. So it can help tailor your supplement routine as well. And then another example would be like the caffeine. So the caffeine sensitivity looks at your heart health risks. So how does caffeine impact your heart health? So you might be noticing poor sleep, maybe some low energy, maybe some increased hunger. You might actually be a slow metabolizer when it comes to caffeine, meaning you're more sensitive to it. So how to apply that if you do have that genetic variant would be maybe an earlier cutoff time when it comes to the caffeine. I'd probably recommend that we reduce the amount of caffeine that you're doing and really working on improving sleep quality and building habits together based on that. Again, genetics testing is a tool. It's not diagnostic. So I'm not, again, going to diagnose you with diabetes or anything like that. But what it can do is it can really personalize your recommendations when it comes to nutrition, can really improve your understanding of yourself. I mean, the more that we know about our bodies, the more we can improve our health overall. Again, being proactive when it comes to our health. It can guide conversations between you and your healthcare provider. Me as a dietitian will use those results in our follow-ups to kind of guide those conversations, and you can always bring those to your doctor as well. And what it cannot do though is predict like exact weight loss. It's not going to be, what's the word I'm thinking of? It's It's a tool. Yeah. Thinking of the genetics as a tool. So really making sure that we utilize those results and apply those to our everyday life. It's not going to guarantee outcomes. It's not going to eliminate the need for follow-up care. You should definitely follow up with your healthcare team. It's not going to replace healthy eating. So you're considering testing, I always like to ask yourself like a few questions. What are you hoping to learn from it? If you have questions about it, let me know, and figure out if testing would be right for you. Based on my results, am I motivated to make behavior changes? Because that's a lot of what we'll talk about. what challenges am I currently experiencing? And then how would the additional personalization benefit me? And then the cost worthwhile for me as well. Oftentimes, these additional tests aren't covered by insurance, so really weighing that as well. And then specifically for bariatrics, I always like to touch base on that because that is my specialty, but really just bringing it back to basics and focus on what matters, meeting your minimum protein goals, taking your supplements, your needs are increased after surgery in general, staying hydrated, prioritizing your sleep, moving consistently, following up with your care team, and then considering the nutrigenomics as a tool and guiding you afterwards as well. And then future science with nutrition, genetics. Right now we test for 70 genes, but I have a feeling in the near future there's going to be a lot more that's going to be tested besides 70. So I think that's going to be expanded. There's a lot coming out about gut health, which is exciting. A lot coming out with blood sugars, more continuous glucose monitoring, and then there's so many, I feel like, different wearable health technologies now, like the Oura Ring, Apple Watch, those things, and which is really neat that we're able to see in real time, like our heart rate and our steps, and being able to track those things at home, which is big and huge. I'm going to go into what the test kind of looks like so you guys can get an idea exactly what genes we're testing for. But Brenda, does anyone have any questions right now about anything? Do you know?
I do not see any questions so far on both either Facebook or here in Zoom. Let's see. Oh, estimated cost of testing, please, is what someone just typed.
Yeah, I have it on my website for me. I'm sure it varies depending on clinic to clinic. For my clinic, it's $400 for a test, and that includes like a meal plan, that includes the test, that includes an hour consultation, and then follow-ups. Usually, insurance will cover follow-ups. Insurance doesn't usually cover nutrigenomic testing, but sometimes HSA cards. I've had patients in the past use their HSA to cover the test as well. How does one request this test? You can fill out it directly on my website, which Brenda will share at the end. You can book a test directly on my website, or you can call my office. Brenda will have my contact information. Um, awesome.
So we'll be sharing that, guys. I'll be sharing that in the chat feature as we kind of go through. If you're able to stay with us on the call, on the replay, if you are watching this late at a later time um, on like our podcast, Very Connected, or on our YouTube channel, which is ProCares, look in the comment section, and I'll have that same information there.
Okay. Okay, so this is a sample test. It's, I think, over 30 pages, so it is a lot of information. So again, we'll cover that through multiple sessions. But it gives you kind of a brief overview of the science behind it. This is something that's evidence-based testing, so everything is evidence-based. So this is kind of what they look at in summary. So we're testing nutrient metabolism, so how you metabolize certain vitamins and minerals. So we look at vitamin A, B12, C, D, E, folate, choline, calcium, iron, and then low iron as well. We look at food intolerances and sensitivities. Specifically, we look at lactose and gluten, and then caffeine sensitivity as it relates to anxiety. We look at your heart health. You'll see caffeine again, but that's how it's related to heart health. So that's looking at a different gene there, but still based on caffeine. Looks at whole grains, which can also help determine your risk for type 2 diabetes. Again, we're not diagnosing you with type 2 diabetes, but it can help you be aware that you're more genetically predisposed to developing that later in life. So knowing that can be helpful. Sodium and how that impacts your heart health. Some people are more sensitive to salt than others, if you've ever heard of salt sensitivity. So that looks at that. Omega 3s, omega 6s in regards to heart health. Omega-3s are also really important for memory too, so it can kind of give some insights on like Alzheimer's disease, physical activity for heart health, which would be more like looking at your HDL levels on your lab work. That's how the physical activity for heart health kind of correlates with your HDL levels. Uh, there's a weight management section, which is what I really highlight in my practice because that's my specialty. So what genetically is best for you when it comes to physical activity for weight loss. For example, some people can work out and see their weight fluctuate greatly, and some people work out a ton and never see their weight fluctuate. So that can be really helpful to see what exactly you should be doing exercise-wise for your body. Energy balance, so really looking at how many calories you should be having a day. Sometimes people should be below the recommended calorie amount for weight loss, actually. So instead of doing a blanket calorie amount based on your genetics, it might actually be lower or higher depending on what your genes determine. Protein, I feel like with bariatric surgery, we always hear that standard like 60 to 80, 60 to 90 grams of protein. This will give you, based on your genes, what protein amount would be best for you for weight management. Fat intake, saturated, unsaturated fat, and so breaking down fat intake for weight loss and body composition as well. We look at eating habits. So this is where they test for the gene that predisposes us for obesity, which is really interesting. So how likely are we to eat between meals? Are you more prone to snacking, which is really interesting to look at that one. Fat taste perception, that looks at, um, they call you like a super taster. Some people need more fat, let's say more butter on something to be able to taste it, but some other people can have a little bit of butter and they taste it fine. So that one's really interesting too, being able to detect fat in foods. Sugar preference, if you're more prone to gravitate towards sugar. And then there's the whole section down below about exercise, motivation to exercise. Motivation's a big thing when it comes to exercise. So knowing if you genetically are more motivated than the average. Exercise behavior. So what kind of exercise is going to be best for your body and your genetic makeup? Power and strength versus endurance. So what your recommendations are for cardio versus weightlifting. And then it also kind of looks at recovery, like injury risks. So muscle damage, pain tolerance, bone mass, and different types of injuries. There's Achilles tendon injury, which would be like if you like to play pickleball, that's really common with short bursts of movement like that. So knowing what kind of stretches you should be doing to help prevent future injury. And then at the beginning, there's a summary of your results. So the summary is going to look the same for everyone. What's different would be your risk. So these red and black on this column, your risk is what is different. So everyone gets the same 70 genes tested. They've got what we're testing for, so vitamin A, B12, what exact gene that we're testing for, and then the RS number is the location on the gene that we're testing specifically. Then the risk variant, again, that is the same for everyone. That means that you would be at risk for, let's say, vitamin A deficiency. And then your variant and your risk, those are what's specific to you. So when I review the results with you, I typically highlight the elevated ones, the ones in red, because those are what's different than, let's say, the average. So if you're at an elevated risk for vitamin A deficiency, I would recommend that you eat more than the recommended daily allowance in the typical person for vitamin A, for that, for example. With that as well, yeah, there's a lot to look at. The vitamins, so When you complete the test as well, I'll have you do a food frequency questionnaire too. So how often you eat certain foods. So I'll be able to compare that as well, and kind of see what you're currently doing. See if you're currently eating enough vitamin A. What are your top food sources for vitamin A? How can we get more vitamin A naturally through your diet, or do we feel like you would benefit from a supplement? And then creating a meal plan based on what you're currently eating and how your genetics plays into that, and really personalizing that as well. Then, so all the vitamins, calcium kind of looks at your risk for developing like osteoporosis later in life. So bone health is a big one with the calcium. Vitamin E highlights on like cancer risk. Uh, the food intolerance section is really interesting, looking at, lactose, gluten, and the caffeine sensitivity. And then we'll just go through all of those together and apply them to your lifestyle. And then it's all summarized too in the report for you because it is a lot of information. So it is nice to know what exactly we're looking for, what the recommendation is based on your results, food sources to be able to apply that, and some more information on the gene that was being tested. So there's a lot of information to read through. And then they give you some additional genetic insights at the end that they throw in that I'll discuss as well. One of them is maintenance of long-term weight loss, which is interesting. So uh, for this one, it's typical. So you have a typical ability to maintain weight loss in the long term. I think that's helpful to know. Hunger's the one on here too. You have a typical susceptibility to hunger, but some people that's elevated, you're more susceptible to being hungry. And I think that can be reassuring too sometimes when we've struggled for a really long time with weight and finally being able to kind of get answers and see how our body works. Okay. That is a really quick overview, and I feel like I talk really fast. So have any other questions come in? Oh, I think you're muted, Brenda.
Thank you. I apologize that I have myself a mute. So I do have a question. Is this coming in from the group? Is this testing kind of a helper in determining certain things, like, for example, fatigue in early afternoon, but all of the labs showed everything normal and on the right target?
Critique could be, yeah, for a lot of different reasons. The Nutrigenomics result can definitely explain some reasons for fatigue. There's sleep quality is one of the things we look at on the testing. Vitamin D plays a role in our sleep. There's the way that we metabolize carbs. If we are doing too many carbs, that can actually make you sleepy too. There's so many factors that can go into fatigue. But if things are all typical, I would say, I think I forgot to mention too that there's no like good or bad genes too. So if something's elevated, that doesn't mean that it's bad. That just is more information for us to see what you're at risk for and being proactive there. So that doesn't mean that it's bad that you have an elevated risk for vitamin D. We'll just consume a little bit more foods with vitamin D or incorporate a supplement. But there's definitely some reasons outside of the test too that could explain fatigue. Like we don't check thyroid function. That could be a reason for fatigue. So that's why it's so important to have a comprehensive healthcare team as well. And that's something that I help with in my practice is coordinating with your doctors and making sure that we're all on the same page. And this is a test that you can take to your doctors too and help get that comprehensive integrative care with everyone.
Sarah, there are a couple more questions. Somebody is asking, can you be on Ozempic when being tested?
Yeah, yeah. That's not gonna impact anything. That's totally fine.
How about, do you give an explanation of the results too, or just the results?
Yeah, I go through the whole thing. So it takes me an hour or so to go through that whole guide with you. And then most of the time your insurance will cover follow-ups with me, so we can continue to follow up how frequent or infrequent you want to really dive in deeper with each of them. But I do spend a full hour after you get the results in to go through and explain everything. But again, sometimes that can be overwhelming because it is like 30 pages of information, and we do create a meal plan with that too. So the meal plan will help, apply that to your life, but being able to really understand what's in the meal plan is what helps with that long-term lifestyle change. So I will go through the results with you. Yeah.
And there's a question. It says, thalassemia. Can you see comments, Sarah?
I can.
So I'm wondering if that is, explain a little bit more, Queen, to let us know maybe your question in more detail. Is that,
I'm looking it up. It looks like thalassemia is a genetic disorder, a genetic blood disorder. Um, so that wouldn't be something we would test with the nutrigenomics testing. I'm assuming that if it impacts your red blood cells, that it wouldn't cause fatigue, but that would be something definitely to bring up to your healthcare provider, your doctor, uh, to see treatment for it. I would imagine because it impacts your red blood cells that it would. Um, on the test, we look at iron deficiency risk, and that impacts your red blood cells too, and that can cause fatigue. I don't think I mentioned that earlier when I was talking about low energy, but that's really all we would look at with the red blood cells would be iron and B12 and folate also can cause anemia. Can you explain how to sign up? Uh, Yeah, Brenda's going to share my contact information. I think she puts it in the chat already too, but you can book it on my website or email me or call me. We can figure out what kind of testing you want to do. And I am in network with Aetna. Uh,
well, Sarah, let's go ahead and do that. Since there's actually questions, quite a bit of questions coming in and what that looks like. I'm gonna jump on to Sarah's website and show you what her website looks like and basically where to find some of this information. So her website is her name, Sarah Polk, and then nutrition. So Sarah Polk Nutrition. And sorry, here we go. We have this is Sarah's homepage. When you get to that, you're going to see some tabs at the top: home, about, services, and contact. Under services, there's the Nutrigenomics here. So I'm going to click on that. And then there's a little video. I'm sure it probably talks about some of the stuff you just shared, Sarah,
yeah.
on the testing, and then the packages. So tell us about the packages that you offer on those two.
Yeah, I would say the comprehensive package is good if you're self-pay and your insurance doesn't cover follow-ups. So that comprehensive package includes more follow-ups with me. The basic package is just the test and your hour review with me and like the meal plan. If I'm in network with your insurance, they most likely will cover follow-ups. So the basic package is better if you are in network, if I'm in network with your insurance. For just the nutrigenomic test, again, that's $399 or $400. And then the comprehensive one with more follow-ups from me outside of your insurance for self-pay is $499 or $500, so an extra $100 for the extra follow-ups.
Okay. So when they do this, basically they could click this schedule consultation down here and it'll bring them to ask them a few questions.
Yeah, it should
And
bring them to book, or it might bring it to my contact page. Um, Yeah, it brings them to book directly. So if they want to schedule and book directly on my website, you can, and just select it and book. Or if you want to fill out the contacts page and I can call you and we can figure out what you want to do and I can help book it for you.
Sarah, would this be what they do this one right here where it's the Nutrigenomics basic package testing kit? And
Yeah,
then this
yeah,
is
if
the
they want to
compre
do insurance for follow-ups, yeah.
okay. And maybe there's more on the bottom here. Nope, that's it.
Yep, that's
So
it. Hmm.
the comprehensive is this second one here, and this is the basic.
The comprehensive one would be more for self-pay patients. It includes an hour initial consultation with me that's covered. It includes the hour review of your testing results, and then it includes a 30-minute follow-up after that. And again, though, if you have insurance, usually they'll cover the consultations. So that's when you would want to do just like the basic package where it says the test kit only and your review. And if you're
Oh,
unsure if I am in your network or if you want me to check with your insurance to see if they would cover follow-ups with me, fill out the contact page and I'll do all that for you as well, uh, too.
so that is probably up here at the top of your
Yeah.
website. So Sarah, say somebody is interested in talking to you as a dietitian. Do you see patients out of state, just not just for nutrigenomics, but for other things too as well?
Yeah. So there's some exciting stuff happening with out-of-state coverage for dietitians within the next year or two. Hopefully, they're working on allowing healthcare providers like dietitians see patients across state lines, but each state has different rules for healthcare. So I am licensed in multiple states. I'm licensed in Missouri. I'm licensed in Illinois, Oklahoma, Nebraska, um, Louisiana. And then there's some states that don't require you to be licensed in it. So just let me know and I can let you know if I would be able to see you if you're out of state. Uh, but some states require a license and some do not. It all is dependent on where the patient is located at the time of the televisit. So, um, and Arkansas, yeah, I am in with Arkansas as well. Yeah.
Um, so Sarah, what would a patient, there are some more questions coming in too as well. Let's see. Okay. How about Blue Cross Blue Shield? And I have another question too for you.
I am in network with most major insurances, so Blue Cross Blue Shield and Anthem, United Healthcare, UMR, Medicaid, Medicare, um, Aetna. Yeah, and I have that on my homepage too, all of the insurances. I'm in network with Cigna. I'm with Cigna. So all the major ones I do accept.
Okay. Arkansas?
Yes, I am
Okay.
licensed in Arkansas. Yeah.
Okay. And she had asked about Medicare and you answered that, Medicare and Medicaid, which is
Mhm.
awesome. What kind of patients, my question is what kind of patients is your specialty? What what type of people can you help the most when you're seeing patients?
Um, Real quick, Texas doesn't require a dietitian license, so I can see Texas as well. Um, and then, sorry, Brenna, repeat the question. You said,
No, that's okay. There's actually another question coming in, and then you can answer. It says, what if you are not licensed in my state? Can you refer us? And she said Iowa.
I'm not sure about Iowa off the top of my head. I'm not sure their laws. I would have to look it up. But the Academy of Nutrition and Dietetics, they have, that's our credentialing platform for dietitians. If you go to their website and click find a dietitian, and then they go by state, so you can look and click Iowa, and they'll tell you all the dietitians that are in Iowa on their website. Um, and then Florida, I'm pretty sure Florida has fairly strict licensure rules. I'm not in with Florida, but same thing. You can go to the Academy's website and um, you can look and see all the dietitians in that state, which is nice.
Sarah, how many dietitians are doing this testing currently? Is this something that you're seeing? And how did you find out about it? Like what brought you to do this type of testing?
been a very emerging field, I would say, within the past 10 years. It's been really a lot of evidence and research has been coming out with it. And when I started my private practice, I wanted to give people, I think sometimes, with we exhaust all of our resources a lot of times. Most of the time, by the time people visit me, they've been struggling with weight their whole life. And sometimes it's just nice to know our bodies better. Again, I think this test gives us better insights, obviously, to how our body works, but I think it can sometimes give people more motivation and reassurance too, especially when you've been struggling for such a long time and being told that it's uh, genetics does have a role in how things or foods impacted you. And with the Nutrigenomics, I found out about it. They attend the Academy of Nutrition and Dietetics conference every year. That's in the fall, and they come and they promote the testing there. So I send the test to a lab in Canada, I believe is where the lab is located, but they serve people in Canada and the United States for the testing.
Good to know. Sarah, what kind of patients do you typically see, and what patients do you feel like you can help the most in your practice? Not just with this testing, but as a dietitian, a lot of these people, so there are people on this call that belong to a surgery program. And obviously, following up the surgery program is always a great way to connect because those are the people that are their primary caregivers. But we also see a lot of people on our podcast that don't have a connection to a program. So what kind of people would you normally see in your practice?
Yeah, I would say, I mean, my specialty and my target population would be weight management services, but sometimes weight management isn't the primary goal. Sometimes I find that the number on the scale isn't the most motivating. So a lot of times I'll see people that weight loss tends to be a byproduct of other things. Most people, even with bariatric surgery, it's a weight loss surgery, but when I ask people what their main goals are, a lot of times it's getting off medications, improving my blood sugars, it's moving my body with more ease. I find that those kind of things tend to be more motivators, and weight loss tends to be a byproduct from making those dietary changes. I my ideal client or my target population is usually bariatric surgery or patients on GLP-1 medications or just patients looking for weight management in general or want to feel better overall. Energy levels is a big one, like we've talked about today, and that was in the chat a few times. And regarding surgery and like the healthcare team, yeah, it's good to have a comprehensive team, and not all clinics have a dietitian, unfortunately, which I wish they all did, but not all do. And I do collaborate with your care team if you want me to. That's something that's on my forms that I have you fill out. If there's a doctor you want me to keep up to date with your health, I give you the option to put them down, and I can communicate with your doctors as well and send them our follow-ups and give them calls. So I think there's definitely value in having a comprehensive care team with having bariatric surgery because again, I always say we perform surgery on the stomach and not the brain, so that lifelong, that mental aspect can be sometimes really difficult afterwards.
Yeah, and I do know some insurances do require so many visits pre-operatively to surgery, and some programs don't always offer that as part of their care package. And so, do you do pre-operative visits, like say they need 6 visits with a dietitian prior to surgery for insurance purposes? Do you do that type of thing too?
Yeah, yeah. So I can see you pre-op and get you that dietitian clearance for surgery. I'll fax my forms over to your surgical care team. That way they can send it off for insurance when you go to get surgery. And then I usually will see you routinely after surgery. I like to meet with you in between advancing your diet so you don't have to advance your diet by yourself after surgery. And each time we meet, we create kind of a meal plan together to help you with each phase of that post-op diet, and then routine care afterwards as well. So pre and post-op, and then I do offer a free support group meeting too that anyone can join in any state. I know, Brenda, you've been a guest speaker on that before, which I always appreciate and love. But last Wednesday of every month, I host a free Zoom that people can come on to and connect with others in the community. So that's also a resource that I provide too.
Yeah, thank you, Sarah. Any other questions coming in, guys? Anything else you have for Sarah question wise? This has been great. And while we're doing this, I'm also going to give a shout out to our sponsor, which is ProCare, is the company that is sponsoring Sarah and I to be here. I'm going to share my screen here in just a moment. I want to make sure I get on to the ProCare site first, and so that I can share properly. Let's see here. Um, Sarah, you've been a proponent of ProCare too, so I appreciate that. Is there any favorite products you have?
Yeah. I like ProCare because yeah, you guys are local to St. Louis, which I love, and then everything's third party tested, which is really important when recommending vitamins. You want to make sure they're quality. I would say the fiber powder has been my most popular in my clinic, actually, the fiber cell. I always say fiber is a dietitian's favorite nutrient. Fiber we love fiber. So, and we tend to not get enough in our diet, especially if you're on GLP-1 medications or have had surgery when your oral intake's down and you're really trying to focus on that protein intake. You vitamin or fruits and vegetables tend to be on the back burner. So sometimes we need a supplement, and the fiber supplement's nice. I get a lot of good feedback on the fiber cell powder. Uh, so I would say that's my favorite.
Um, and on the fiber, it's found under our therapeutics, I believe. I'm going to kind of go down under that. So on our tab on our website, and they come in little packets. You can buy them separately or individually, or you can buy like a canister and do your own. And it's soluble corn fiber, which is really well digested. There's actually companies out there that market with different names besides fiber cell. And I will say this is probably one of the cheapest. Our company with this particular product, it is inexpensive. So like for example, this here one box is $12.99. It mixes well with it has a little bit of a sweetness, but really no taste, and it mixes well with almost anything. You could put it in coffee, you could put it in food. So that is definitely a fun little thing. And I feel like patients, that's one of the biggest things they do struggle with post-operatively, bariatric surgery, especially, and being on the GLP-1s is kind of that gut health. You know, a lot of times it's related to maybe a little dehydration because we're not getting enough fluids, or maybe not enough physical activity right after surgery. It could be anesthesia. It could be just that change in our body's composition and the way things kind of move through. It's just different, and sometimes it can kind of the fiber can help with regulation of that. So thanks for bringing that up, Sarah.
Yeah, of course.
Sarah does have a discount code, which I am going to share in the chat box. And she is an affiliate of ProCare. So basically, you guys, when you use her link, you save 10% off. It's SPN for it stands for Sarah Polk Nutrition, the number 10 for 10% off your order. So I'll put that in the comment, but if you're listening to a replay, it'll be in the section where you can find in the description, or the the section where you have a whole listing of all Sarah's information. So I'm going to stop sharing here in just a moment. Also, I want to say, guys, if you're ever looking for any of our upcoming events, we have those listed under Berry Connected. And Berry Connected, once you pull up that page, we'll have the event for the month. So right now, Sarah's is still on there. This event will be what we call on demand. So immediately following, usually about 30 minutes it takes to process the video and so forth. it'll go into what we call on demand, and you can watch any of these videos if you're not able to come to the lives, or if you have to jump off earlier. It can be sometimes a little difficult to be able to jump on and watch the whole thing. So come back, listen, watch again, and you can definitely learn even more. We also do have a YouTube channel. It's under ProCare Health. And basically, any kind of event, I was showing somebody a while ago, you can actually type in something like hair loss or whatever, because we have different, over 500 videos now on there. So depending on what your interest is, you can use the search feature. If you press the subscribe button, it'll allow you to subscribe and go to, you'll get notifications when new events are placed on there. Sarah's event will be on this YouTube channel. We usually apply all of our events the Tuesday following the event. So you'll see hers there very soon. And let's see, I also wanted to say that link for that is on the Very Connected page as well. So you have that on there. It's down here towards the bottom. And guys, if you're looking for more community as well, we do have a Facebook group that we have. Join our community, our page, and also our group, and become part of this ongoing support that we offer. So I know some people's needing to jump off. So I just want to thank everybody for being here. Sarah, I want to thank you for the time that you took to be a part of this event and to share your knowledge and everything that you've shared so far. Did you have any closing thoughts that you'd like to share?
I just want to say thanks for having me. Everyone in the comments has been very positive and supportive. I think this is a really good community, and that's why I've had this as my specialty for so many years. So if anyone has anything they have questions on, feel free to message me in my email or call me. And yeah, thank you so much, Brenda. I'm honored to be here.
Yeah, thank you, Sarah. And I know somebody had asked, you want to keep it, they want to keep attending the calls. Is there a place I can officially sign up? So basically, whenever you attend one of these groups, if you've put on the registration form, there's a check mark that says, I allow for I allow for marketing basically to be sent to me. We do put you in a sign up to get an email that says our next event is, but you can also always go to that page that I just showed you on our ProCare Health website. It's called under resources and then very connected. And basically on that page, every month we will always have our events that are coming up. So anyways, everybody enjoy the rest of your day. Have lots of sunshine. And until we meet again, stay very connected. Thank you so much. Bye, everybody. Bye, Sarah.